morning, Frank. Good morning. Thanks for having us here. Good morning, everybody. An honor certainly to be able to introduce you. Mr. Toral is the senior partner at Toral Law. You all probably know it's a statewide firm that deals with brain and spinal cord injuries. As chief of neurosurgery at a level 1 trauma center, I obviously see a fair amount of those, and I've had the honor to meet and interact with Mr. Toral over those patients, as we'll get to in a second. A passionate advocate for the families and the patients with head and spinal cord injury. He's held leadership roles in multiple different organizations: Brain Injury Association of Florida, Brain Injury Association of America. He is the current legal editor, I should say, of the Brain Injury Professional magazine. Proud father, proud husband, his wife Olivia, 2 children, Nina and Noah, right? 7 and 5, busy. But we're all here today because of the Toral Family Foundation and because of Frank. As you heard earlier with Dr. Stead, there's an endowed professorship at the University of Florida College of Medicine. There's a center for brain injury there. But more importantly, because he probably won't tell you that he was freaking out because I arrived here about 6 minutes ago. And I arrived here 6 minutes ago because, as my life usually goes, at the last minute before I was leaving Boca, I got called for emergency surgery. And it never becomes more acutely aware of the role that Mr. Toral plays, because I did hours worth of surgery. And he and I have had this discussion multiple times. All those hours of surgery are for naught if there's not an advocate in the post-operative period and an advocate for their rehab. And unfortunately, the dark side of the beast is that once they exit the doors of that hospital from their acute hospitalization, there's a lot of access that gets lost. And a lot of people are happy to turn the other cheek and not look at that, and fortunately Frank has not, and in fact he's locked horns head on. And hopefully, championing meetings like this, we'll find a solution. So without any further ado, Mr. Frank Toral.
Thank you, Dr. Zucker, for those very kind comments. I want to just welcome everyone here. I look around in the room, and we've used the words team, and we've used the words advocates, and all of you are that. And my desire today, more than anything else, is to add value to each and every one of you by hopefully allowing us to learn something that we haven't previously considered that can really bring a contribution and a meaningful difference to the lives of the families that we serve. So I am truly honored to be spending some time with you. And during our time together, if I had one goal, it would be this: to expand our paradigm of what's possible when we collaborate. And I'm going to use that word a little bit and hopefully give you a different context of what that means from my world to collaborate. But before I begin, I want to acknowledge I'm also a pastor, and the Bible says, give honor to whom honor is due, and so I'm going to do that now. And I want to acknowledge all of our distinguished guests, in particular the State Surgeon General, Dr. John Armstrong, all of our distinguished guests, our sponsors, and the Conference Planning Committee, represented by leaders from UF Health, from Brooks Rehabilitation, and from Wolfson Children's Hospital. And I also want to take an opportunity to thank our law firm staff, who have these little badges that say Volunteer Toral Family Foundation. They've worked tirelessly to put this conference together, so I'm proud of them. But in particular, I want to thank someone without whom we would not be here today. I want to thank Dr. Joseph Tepass. And the reason I want to thank Dr. Joseph Tepass is because he's been doing this for so long, for so many years. He's been a tireless advocate for not just kids, but for families, for Florida's trauma system. And I can tell you that without his enthusiasm, without his commitment, he was the catalyst to make this possible. We wouldn't have the privilege and the opportunity to spend just a few hours today talking about brain injuries. So can we give all of these folks a hand, please? This conference was developed around the idea of bringing together leaders in healthcare around this crisis, this public health crisis we know as TBI, or traumatic brain injury. And I think as leaders, we all understand that the only way to positively change the game is to influence the influencers. And ladies and gentlemen, you were selected on purpose. You were invited on purpose because you, in the state of Florida, are those influencers. So my highest appreciation is reserved for all of you. So I want to extend a heartfelt thank you for those of you that are here, those of us that are watching online, and especially those that have jumped on planes from all over Florida to be here with us today. So I want you to give yourselves a hand for your commitment, your passion, your dedication for being here. Can we do that? Fantastic. Many of you have asked, Frank, why did you start the Toral Family Foundation? Well, as Dr. Zucker pointed out, our law firm specializes in brain and spinal cord injury cases and been doing that for a long time. And I thought about what's a way that we can be able to give back to the community, to be able to partner with the healthcare community to improve the lives of all of the families that we serve. And so after representing people for so long, we said, you know what? We want to do something to be able to give back to do just that. But my heart is to give people hope. I mean, that is, whether it's the role of an attorney, a dad in church, through the foundation, at the end of the day, I want to be able to leave this life having given as many people hope as I possibly can. And so that's what we did when we established the foundation. We structured it in a way that we could give hope to families and to the community in 3 ways. So the Toral Family Foundation provides hope through, the first thing is research, the second thing is education, and the third thing, which I'll talk about in a moment, is resource. The research you heard about by Dr. Gonti, we're sponsoring a multi-site registry. The other site is also Delray Medical Center under the leadership of Dr. Zucker. And the second site that we started under the leadership of Dr. Jillian Hotz, who has also been a tireless, committed, passionate advocate. She's a friend, and she's a friend to all of those who sustain brain injury, not only in the state of Florida, but nationally. So supporting research, and the reason that we're supporting the research is because research, we have to take the long view, as was set up here. Dr. Armstrong talked about the long view, and that's what research does. By following these families 5 years out, speaking to them, asking them what made a difference in their lives, hopefully we're able to better understand the disease of trauma and the disease of traumatic brain injury. So that's what we do through the research end. The education end, you're sitting in it. The education end is bringing together passionate, bright, intelligent people, stakeholders in this TBI world, so that we can learn from one another. We do that at conferences like this. I believe we have a smaller conference, Tampa General, in the month of November, and we also do little lunch and learns at private practice and neurology groups that educate the staff and some of the neurologists about some of the issues that we face as lawyers that they may not see every day. So I'm going to turn the camera around for just a second on you, kind of take this bright spotlight off of me, and I want to ask you a question. How many people here today came to hear something new, maybe a new perspective, a new idea, a new approach in this field of brain injury? Okay. I noticed that not everybody raised their hand, so those of you that didn't raise your hand, you can be honest, it's okay, he's in the other room. How many of you just came to see Dr. Gupta? Is that okay? Because that's all right, because that's one of the reasons why I'm here. So that's a perfectly legitimate reason. While I sincerely hope that being here today educates you and inspires you, my highest hope is this. My highest hope is that this conference gives you an opportunity to connect with each other and explore the possibilities that lie in that connection. Last year I attended a graduation ceremony of Dr. Gonti and our law firm CFO, Tom Hoy, at the Kellogg School of Management at Northwestern in Chicago. And I remember that graduation ceremony where they were getting their MBAs for two reasons. I'm a Florida boy, and Chicago was freezing. And so I remember it was frigid. I remember just the taxi cab drive, it was so cold. The guy didn't have his heat on, and I was just shivering. So walking in was a very cold experience for me, but then when I began to hear the commencement speakers, it was anything but that. And I'll never forget one of the commencement speakers at this graduation ceremony, what she said. She stepped up to the mic like this, very poised, and here's what she said around this idea of connecting that we're talking about. She said, "The power of your network transcends your knowledge." What I've discovered in business and in leadership is that many of the challenges we face as professionals are often as close as those closest to us. So what I'd like us to do in an effort to connect and to get to know each other over these next 5 minutes, this is a little unorthodox, but I'd like us to try. Over the next 5 minutes, I want you to kind of go around the table. And without telling people your title, because I know everybody here has got some pretty big titles, I want you to answer, just take 30 seconds and answer one or both of these questions. The best part of my job is, and maybe it's working with families, maybe it's leading a team, maybe it's doing research. So go around the table and say, the best part of my job is, you fill in the blank, or the most challenging part of my job is, and if you're with your boss sitting at your table, it's okay. You get a pass. So that's quite all right. And you know what? Even if we know the people that we're sitting across, you know, it's often about asking the right question. Because if we ask the right question, sometimes the answer comes right at us from the people that are closest to us. So can we just take 5 minutes, go around the table, and the best part of my job is, or the most challenging part of my job is? Why don't we do that?
That was going to be my challenge.
The worst part is ideas, inventions, and technologies that can prevent people from getting an injury. And it's a difficult thing to make.
Okay, we'll take about 1 more minute. A couple more minutes. Okay, so here's a question. How many of you learned something new about someone around the table this morning? So you wonder how that happened. I think it's pretty self-evident. You talked and you connected. But for me, connecting has not always been that easy, especially as a lawyer, connecting with members of the healthcare community. And I thought about, why is it so difficult to have a conversation? And as I began thinking about why it's so difficult to have a conversation with members of a profession that care for the clients that we represent, I got to thinking, and I think it's because of the perception that both the medical and legal communities hold of one another. In the current environment, and I've gotten some insight into this because many of you are friends of mine that are in the healthcare industry, all of us, most of us, and you've really given me sort of a different way to think about it. Because everyone likes to think that they're liked and that what they do is recognized, but that's not always the case. And so I found, just on the feedback that I've gotten, that the current environment between the healthcare profession and the legal profession is marked really by 3 things. And it is distrust, disconnection, and non-cooperation. As I really looked at this, it occurred to me that these attitudes are shaped by the extreme aspects of both communities. For example, the vast majority of lawyers, including myself, have never handled, nor have any desire to handle, a medical malpractice case. Yet lawyers are perceived as threats to the system. Conversely, while there are comparatively few serious medical mistakes, there are some in the legal profession that express a lack of confidence in the healthcare system. And I think we all instinctively realize that these extreme positions do not represent the caring and committed medical and legal professionals that add value to the lives of the patient families that we serve every day. So let me ask you a question. If you could think back, do you remember what first motivated you to get into healthcare? Maybe as a little boy or a little girl, you watched some doctor shows. Maybe you walked around with a stethoscope. Maybe you were really good in math and science, and that was your natural pull. And guess what happened? You had a dream when you were a little boy or a little girl, maybe a teenager entering college, that you wanted to be in the healthcare profession, serving others. And look what happened. Today, your dream came true. And if I had to guess why you got into healthcare, without asking you the question, I would guess this. It's because you care about other people. And you had a desire. What a great word that is, desire. You had a desire to make a meaningful difference in the lives of the patient families that you care for. As I was reflecting on why I went into the practice of law, my motivation was a little misguided and a little different. You know, as a teenager, I would watch episodes, I'm going to date myself here, I would watch episodes of Miami Vice. How many remember Miami Vice? Yeah, and so I would watch on a Friday night before I'd go out with my friends. I was 17, 18 years old, and I'd watch Miami Vice, and I would picture myself driving around in a white Ferrari, chasing drug dealers, or representing drug dealers, I should say, and then... Yeah, exactly. And pulling up to the courthouse in my white Ferrari with my, I know this is sacrilegious to say in this room, but with my alligator briefcase. And I was definitely misguided. But you'll be glad to know that fortunately I grew up and I don't represent drug dealers and I don't drive a white Ferrari. I drive a black one. Just kidding, you gotta have dreams. We are environmentally conscious in my home, right, Olivia? But the truth is, as I began to practice law, I discovered something about myself. That I have a passion to help people that are hurting, and especially those who sustained a catastrophic injury like a TBI. You know, and I know that when a patient sustains a TBI, it's not just the patient that goes through that experience. We know this well. The entire family is thrust into crisis, into this world of confusion, where they have so many unanswered questions and so much information coming at them at once. Those are the people that you and I care for. And caring, don't miss this please, caring is the common ground that connects our professions. We care for the same people at the same time during the same traumatic experience, albeit in different roles, but complementary ones. So here's what I'd like us to grasp, that caring is the connection that leads to collaboration. Why should we in the healthcare and legal communities collaborate? Well, in today's world with the speed and accelerating pace of change that's coming at us, we can't learn everything by ourselves. You know, Ken Blanchard, the author of The 1 Minute Manager, said this: people are finally getting that no one of us is as smart as all of us. You know, I strongly believe that collaboration is the new narrative in improving patient-family outcomes following a TBI. You know, from my perspective, we can sit on the sidelines, on opposite sides of the field, watch the game pass us by, watch other people play the game, or we can do something. With, as Dr. Armstrong mentioned, approximately 100,000 TBIs every year in Florida, that's a big number. Something must be done. When Florida TBI non-fatal hospital admissions cost this system $1.5 billion, and that data is a couple years old, something must be done. As Dr. Tipaz pointed out, when the most vulnerable of the population are 0 to 14, and if you drill down that number, it's really kids. It's infants to 4 years old. They're at greatest risk for TBIs. Something must be done. When 7 out of 10 families do not have the insurance or financial resources to get the care that they need to get better, something must be done. So what's the biggest problem Florida families face following a TBI? It's this: The number one barrier to care facing Florida families after a TBI, it's not going to surprise anybody in this room, it's access to financial and insurance resources. You know, we all intuitively understand that there is a direct correlation between that access to insurance and financial resources and improved outcomes in TBI cases. Taking out all the fancy words, if you have the insurance, if you have the wherewithal, the private pay to pay for the care that you need, you're likely going to achieve a better result. So why are families falling through the cracks? Thousands of Florida patient families across this state, mostly uninsured and underfunded, that experience a moderate to severe TBI, and I believe that Dr. Tebas, you can correct me, but that definition is as having a GCS of 12 or less, or a Los Ranchos scale of 8 or less. You know, those folks have permanent cognitive deficits requiring long-term and often lifetime care. And despite the dedication of a wonderful trauma system and rehab professionals, many of whom are represented in this room, and an advanced trauma system with a dedicated brain and spinal cord injury program, the system can't fund everyone. They can't fund everyone's long-term needs, and the truth is, it shouldn't have to. The result is that once these families leave the trauma center, they're not receiving the full spectrum of services that they need. They're not receiving the psychosocial support, the medical and rehab support, the educational support that they need to live better lives. And I want to share a story with you about this power of collaboration that I'm talking about. You know, a few years ago, I received a phone call from Dan. And Dan was the father of Cindy. I'll never forget it. I was in my office and he called and he said, Mr. Toral, very formal voice, wasn't kind of accustomed to listening to that kind of voice on the other line. Very formal, kept calling me Mr. Toral and said, you know, sir, my daughter has been involved in a horrific accident. She's in a trauma center. She's in a coma, and his voice started to crack. And I'm thinking that this gentleman sounds like he's in the military, just the formality with which he was talking to me. And sure enough, he was a retired officer in the Air Force, Navy, excuse me. And so he said, Mr. Toral, can you come to the trauma center? We'd like to talk to you about this to see if you can help. And it was in North Florida. And so I jumped on a plane. A couple hours later, I was there. And I walked into what many of you are familiar with. I never get used to this, and I don't know about you, but it was an emotionally charged environment. And there's this beautiful 19-year-old girl, intubated, in a coma. Dad is there. I met Mom, and they were just like deer in the headlights. We've seen that look, haven't we? And so I got there, and when I got there, I had my lawyer hat on. And so I'm in the room, kind of like what Dr. Ganti was saying, you know, anything beyond the ER is long-term, but for me, anything beyond the legal aspect of what's going on was outside of my box. And so I'm thinking, okay, is there a case? The trucking company that hit him, do they have insurance? Was she wearing her seatbelt? How did the accident happen? So I'm thinking all of the legal things that I'm supposed to be thinking so I can try and help this family. So I'm doing this mental checklist, and I went off the checklist and I said, you know what, Dan, we're going to take the case. You know, we're going to try and help you out. And so after that, fortunately, I think a few days later, I got the phone call that Cindy had woken up from her coma. And that was a very good thing, to the relief of her mom and dad, who wondered to me whether she would ever wake up. He had a lot of questions, and admittedly, I was ill-equipped to answer those questions. You know, as uncomfortable as I became at not being able to address his questions, I reminded myself, Frank, you're just a lawyer. You're not a doctor. You're not a neurosurgeon. You're not a trauma nurse. Just do your job. And so I started doing my job. But right away, Cindy's case presented an all too common scenario that I think you can relate to. Both she and her family were uninsured. And although I was reasonably confident that we would get a settlement for her, Cindy needed help now. She needed help today. And I wasn't able to do that. And all the questions came rushing into this family. Who would pay for her medical bills? How would she get the rehab and care that she desperately needed? Where would she live? Dad was physically unable to care for her, as was Mom, so who would? And we know, we'd heard from Cynthia Parsons, often family members are the ones ultimately that become caregivers for folks that have severe injuries. So what did I do? Well, I did what any lawyer would do. I did my job. And so as a lawyer, I investigated the case. I hired the necessary engineers and accident reconstructionists. I think we even hired a pilot to fly over the scene to take some aerial photographs. I hired medical experts as well to prove the severity of Cinda's injuries. And we also hired what's called a vocational rehab expert to design what's called the life care plan. And a life care plan is nothing more than an estimation of the total future cost of medical care. And this expert said, Frank, it's going to take about $8 to $10 million to take care of Cindy for the rest of her life. And so, just as a side note, there is no insurance policy, there is no government benefit that funds that extent of care, $8 to $10 million. It doesn't exist. At the same time that we were litigating the case against the trucking company, a funny thing happened. You know, I realized something about myself and what I was doing in my lawyer box. Legal representation by itself would be insufficient to meet Cindy's comprehensive medical and non-legal needs. I had no idea what to do, but I knew that I had to do something. So I stepped out in faith and threw myself into Cindy's complicated world of the uninsured. And at first, I remember my interest in her case was kind of met with skepticism. Why does this lawyer want to talk to the case manager? Why does this lawyer want to talk to the trauma nurse? Why does this lawyer want to talk to the neurosurgeon? But I humbly persisted, and I tried to convey, I just want to help, because I know at some point you guys are going to discharge her, and I want to be able to do something. So I think they got that pretty quickly, and we began to work together. And a cool thing happened. As we began to work together, we started to share information with one another. And I used that information to craft a discharge option for Cindy that ultimately made a pretty good difference in her life. You know, we decided on a facility where she would go after the trauma center, and we decided on a facility that would accept what's called an LOP. An LOP is a letter of protection. It's basically an agreement that the law firm and the client will pay for the rehab and health care once the case settles. And I'm happy to tell you that the case eventually did settle. And the beautiful 19-year-old girl that I saw in a coma that day is today still the beautiful girl and young lady. She's living out of state, she's independent, she's living next to mom and dad. And that result only happened because both healthcare and legal got together to come up with a creative solution. So for me, Cindy's case was not so much of the success story as it was a realization that prior to jumping into her world of healthcare, I had probably failed some of my past clients that needed the same thing that Cindy needed, but I just didn't know how to help. My paradigm had unexpectedly shifted, and thinking outside the box was not enough. I realized that I needed a bigger box, a box that included people like you, committed, passionate, and willing healthcare professionals that were willing to work with Cindy's lawyer because they appreciated the bigger picture. And I can say with great confidence that Cindy's medical and rehab team, they were the most committed, or one of the most committed and caring healthcare professionals I've ever had the privilege of working with. And Cindy's story is a vivid example of the great benefit to TBI families when the legal and healthcare communities collaborate as a true multidisciplinary team. You know, traditionally when you think about the word or the phrase multidisciplinary team, it's usually in the context of an incoming trauma alert, right? And we know an incoming trauma alert, and I apologize if I don't encapsulate all the medical specialties, but that team, that multidisciplinary team, when a TBI comes in, consists of a neurosurgeon, a trauma surgeon, an ER physician, an anesthetist, a radiographer, a trauma nurse, and others. And to be sure, that multidisciplinary team is vital to saving that life, to resuscitating that patient, to preserving that life in that golden hour. And without that team, the patient doesn't stand a chance. But from my perspective, and here's what I want to challenge all of us with this. A true multidisciplinary team provides comprehensive support and services beyond the trauma center, with the patient family at its center. And just like you play a vital, important role in managing the patient's injury following a TBI, a legal team focused on TBI plays an important role throughout the continuum of care. When I walk in and I looked at Cindy, I was looking at Cindy in the context, she was 19, what would she be like when she was 49? 30 years down the road. So when we walk into a room, I have to have the perspective, the burden, the weight of looking at who's going to care for Cindy when she's older. Mom and Dad may pass, and now what? Who's going to care for Cindy? So our continuum of care for patient families is resuscitation, rehab, and 20, 30 years down the road. In a TBI case, the timing of when a brain injury legal team is hired is crucial. And I want to give you, this is not a promotion for our firm. It is a window into the practice of law as it relates to the patients that you serve. And that's what I'm trying to convey here. We saw on the screen that most TBIs in Florida are from falls and motor vehicle accidents. Let's take a motor vehicle accident, for example, a bad crash. We hear about them all the time. In a bad crash, there's usually witnesses. It usually happens during rush hour or when there's a lot of people around. But the problem with witnesses is that they become reluctant to cooperate over time. People have to move on with their lives. And it's typically a rush between the plaintiff's law firm and the insurance company to get to the witnesses. And the more severe the injury, the more resources the insurance company brings to bear on racing to get that witness statement. Evidence such as the vehicles themselves, black boxes, safety systems, steering systems, they can be compromised, lost, and yes, even in some extreme cases, intentionally destroyed. So by waiting just a few days to hire a brain injury legal team, the family of your TBI patient unwittingly allows the insurance company to gain a decided advantage against our patient families, which almost always results in a decided disadvantage to them. I respectfully and humbly admit to you that we are an integral player on the multidisciplinary team that serves TBI families. So that's what we do as brain injury lawyers. But just as we discovered that the traditional role in healthcare doesn't fully address the complexity of all that these families are dealing with after a TBI, I have to admit to you, the traditional legal approach is just as insufficient. So it's for this reason that we have incorporated, and this may sound strange to some of you, but we've incorporated a healthcare component into our law firm called care management. What is care management? Well, here's that word again. It's about connecting. It's our licensed clinical social worker connecting with the trauma social worker. It is our trauma nurse connecting with the hospital trauma nurse. And the value of that connection is when the patient family wins, when the healthcare system wins, when the legal aspect wins. All of that contributes to higher quality, patient, family-centered care. You may be thinking, Frank, that sounds great, but what does that look like? Maybe I can illustrate this. Tony was walking along the side of a road in North Florida when a delivery truck driver, the case settled confidentially, so I can't tell you the name of the company. You would instantly recognize it. This person was on his cell phone, and Tony's car had broken down. He got out of his car. His girlfriend was in the car, and he's walking along the shoulder to get some help. And the delivery driver runs into Tony, catapulting him into the air. He lands on his head and neck, and next thing you know, he's airlifted to the trauma center. And when he wakes up, he realizes something. He can't move from the neck down. And the reason he can't move from the neck down is he was a complete C1 quadriplegic. And the greatest realization, or the thing that impacted him the most, imagine this, was not that he couldn't move from the neck down, but that he couldn't hold his little girl. That he knew that he'd never be able to hold his little girl again. So Tony had a tremendous amount of issues, both medical and non-medical. And so what we did, to give you some insight into what care management does, is we jumped in. We didn't have many answers, but we decided that we had to do something to help his mom, his daughter, and him. So we were the primary interpreter. You know, sometimes families need to have the information broken down to them. So we were the primary interpreter and point of contact between his mom and the trauma center. We participated in case management meetings after they realized that we were there not to file any lawsuits, but we were there because we cared about the same thing. We applied for Medicaid disability. We created a discharge plan. We did a lot of things for Tony that law firms traditionally don't do. You know, I had an opportunity to speak to Ron Savage invited me to speak to a number of lawyers at the NABIS conference in New Orleans a couple weeks ago, and unbeknownst to me, I thought I was speaking to doctors. And so 20 minutes before I walk into the room, Ron's like, no, Frank, there's about 90 lawyers in there. So talk about stress. It's just, I was like, oh. So I walked in. I don't like talking to lawyers. I much prefer talking to you guys. They're kind of meaner. But, so, you know, as I talked about this issue of meeting the healthcare needs of families, you know, there was a mix of looking at me like, dude, what do you like, have three heads on? We're lawyers. We're not going to worry about that stuff. But then I saw a few people taking notes. And then someone said to me afterwards, why would you give away your secret? Why would you tell other law firms what you're doing? Because families need help. And I hope every law firm down the road in America and across this state recognizes that families need more than just lawyers. They need people that care from beginning to end. And so that's what our care management team did. And just a little bit about what the proudest thing that we did for Tony. We worked with the social worker, and we were able to get him transferred. The hospital was spending a fortune on his care, and he was uninsured. So we arranged to have Tony transferred to a hospital south of where he was at. And I remember the CFO of the hospital calling me and said, Frank, tell me about this case. We're willing to take a chance and wait to get paid through this LOP process, but you got to tell me, what's the likelihood that we're going to get reimbursed for this care? I mean, this could be a significant investment for the hospital. And so we chatted about that and talked about that. And he also had to be in a special ventilator-dependent unit within that hospital. And the CEO of that facility called me and asked me the same questions. I mean, healthcare is a business, and no one wants to be unprofitable or lose money because that affects the next patient that walks in the door. And so when we settled the case, and we settled the case 2 days into trial, we tried the case in Tallahassee. And just a side note, when we presented all the evidence at trial, an amazing thing happened, and I know there's a few members of our team here that can attest to this. They flew in a big fancy law firm from New York to help try the case, and there was a jury that was already in panel that had listened to all the evidence about how the accident happened. This law firm and this insurance company was so astute, they actually hired a mock jury that looks like and has the same background as the jury that was in panel. So they flew in these people, and they're listening to the evidence. And you looked at the jury, and then you looked at the mock jury, they looked identical. I thought that was brilliant, and I'm like, uh-oh, we're in trouble. But actually it worked out to our advantage because I think they got the message that Tony had a devastating injury that was not his fault. And so all that to say that the success story with Tony's case was that we were able to settle the case, and I think that we ended up paying the hospital about $900,000 or a little over $1 million out of the settlement, and we were able to pay that special care place about $900,000. And I can tell you, Tony's doing great today, but had that hospital not taken a chance, had that special unit not taken a chance, I don't think Tony would be here today. He would be somewhere in mid-America in a government-run nursing home. Instead, today, he is in a beautiful group home in Florida where he gets to visit his little girl every day, and his family visits him every day. And I take a tremendous amount of pride in that, not so much because it was me, because I couldn't have done it by myself. It was because of you. It was because of the healthcare industry appreciating the bigger picture and said, you know what? On select cases, we're going to take a chance. And we're going to take a chance, and we're going to make a difference in the lives of other people. And that's a tremendous success story for us. Now, I was speaking with an office manager of a prominent neurologist office the other day, and she was sharing with me that the practice of medicine has become increasingly challenging. Here's what she said, and let me see if anyone thinks that this is not accurate. Patients don't, through managed care, patients often don't have insurance. They don't get the care they need. They get lost in the system. When they do have insurance, there's no coverage sometimes for extended treatments. The insurance companies often deny many necessary services, even when they cover an MRI, for example. That now requires full history and burdensome documentation. And their income is dropping because they have to see more patients just to keep up, and they can't spend the time that they really would like with each patient. They can't spend the time educating the families on how to take care of their family members. You know, in serious TBI cases, we offer kind of a solution to help improve understanding of doctors' offices of how medical and legal can work together. And we're real selective in terms of the TBI cases that we take, just to kind of give you some perspective. Hospital bills can run into the millions of dollars for TBI patient families. When you bring these cases to court, the best and the brightest law firms are being retained to represent the interest of the people that cause these accidents. And they're just doing their job. They're not bad people, but make no mistake, they're spending hundreds of thousands of dollars, sometimes millions of dollars to do two things. To say that the patient is not as severely injured as he or she says she is, and two, that the accident wasn't her fault. And so that's kind of what we're up against when we're able to take on a case. About 20 years I've run a law firm, and so I understand the frustration that you have in dealing with insurance companies and trying to get paid. And insurance companies aren't bad. I mean, if it wasn't for insurance companies, we wouldn't have the opportunity to fund the care that our patients need. But I understand that both in your profession and mine, there's a lot of administrative oversight. Lawyers make things more complicated than they have to be. And there's a lot more paperwork and less time to do what we went to school to do. You know, it's for these reasons that I believe and I'm passionate about, it's especially important to work together. Because here's the deal. You can do something by yourself, and someone said this word, silos. I can remain in my box and in my silo. You can remain in your box and in your silo. And you can go on doing your thing, and I can go on doing my thing. Or together, we can do something special. Together, we can change the game. And when we change the game, the patient family wins. You guys have been a terrific audience. Thank you so much.